In a recent Kaiser Family Foundation poll, 1 in 4 said they or a family member had problems paying for health care in the past year, and roughly 1 in 5 said that they didn't fill a prescription because of how much it costs.
Yeah, it can get really expensive, but it turns out patients may be more powerful than they realize when it comes to prescription drug spending. We're joined live now by Joshua Fredell, pharmacist and senior vice president at CVS Caremark. Thank you so much for being with us.
Yeah, thanks for having me.
You know, we're talking about this when you look at those numbers and the skyrocketing really costs of prescription medications. This is a crisis for a lot of Americans. How can people deal with this without compromising their health? When you hear people are going without their medications, that gets me concerned.
Yeah, we definitely want to have affordability for patients. So what I'd start with is first the price of drugs. It can be high. Those prices are set by the makers of those drugs. But for individual people, what they really want to understand well is their prescription drug benefit. A lot of people don't understand or maybe realize that for a lot of healthcare conditions, there could be many very low-cost, affordable treatment options, such as generic drugs or preferred brands. So first, starting by knowing your prescription drug benefit, looking to see what it is, can be very powerful for people to start making different choices, or at least having those conversations with their doctor where they may have lower cost options.
Yeah, you make a great point. A friend and I were on the phone yesterday talking about we never know really what our benefits are, which is terrible. Well, a lot of people don't though. So what are the key steps to make the most of our benefits?
Yeah. One is, have those conversations and start getting that information. Understand your prescription drug benefit, whether that's talking to your health insurer or your pharmacy benefit manager, using their website, knowing what those options are. Once you have that, you can have that really informed conversation with your doctor to say, for example, if you're using a medication for diabetes, you might be able to just simply ask, I see there's other options. They're in that low-cost generic tier. Could those work for me? Having that kind of conversation can be very powerful to both find new choices, but again, lower cost options that improves the affordability for the patient.
You know, something that I didn't realize when I was younger, and now that I'm getting older, I recognize how important it is to have either an HSA or FSA. Can you talk about the benefits of both of those types of programs and where you see them really being a benefit to consumers?
Yeah, both of those are really important programs, especially if you're younger, healthier, not needing to use the healthcare system too much. Starting to put money towards an HSA or an FSA really helps you build up that kind of checking account, if you will, to be able to use towards healthcare expenses in the future. So at a time where now suddenly maybe you need a medication and you're figuring out how do I best afford it, you'll have that, in essence, that is savings to put towards that. So making those contributions now and early really will add up to greater options for affordability in time.
Yeah, and as you start researching into your options, I think there's always a point where you're like, wait, who do I call? How do I get more information? So how can people connect with experts as you start exploring this and don't understand parts of it?
Sure. From a healthcare benefit perspective, talk to your healthcare insurance company or your pharmacy benefit manager. They can help you understand, again, what's on your plan, what are your options, what are those costs. If you get your health insurance through an employer, talk to them about if they have an HSA or FSA option. But then from other options, talk to your local pharmacist, talk to your doctor, because sometimes the things we can do to help really improve our health and affordability aren't around the medicine, it's around the lifestyle changes or the wellness steps that we can take now to really help us be healthier and thus have less cost and time.
Okay, Joshua Fredell, thank you so much for being with us. All really helpful information this morning.
Great, thank you.